Hi, this is Dr. John Wigan. I'm the Chief Medical Officer for National Church Residences. And we wanted to put out a podcast about coronaviruses because they're in the news and it most likely is going to be a health concern that we're going to have in the United States for at least the next several weeks or perhaps months. Although there isn't a whole lot that is absolutely known about this specific strain of virus, we know that it's very contagious, and we need to take steps now to try our best to keep the spread of this potentially hazardous virus to a minimum. So what we wanted to try to do is provide a podcast to support you in your workplace, but also because this is important not only for your health, but for the health of your family and your communities. What I would encourage you to do is, along with this podcast, we have several flyers and handouts that you can print out. If you could make sure that you read those and also discuss them in your workplace and post them when you see them to be appropriate for your specific workplace. That will go a long way to at least educating people in what's known and what's recommended from the Centers for Disease Control, or the CDC. The most important thing that I want to stress in this podcast is that you should wash your hands frequently. And what I mean by washing your hands is using hot water or warm water and soap. And the way I learned it is to say at least one verse of Old MacDonald. And as you're doing that, if you wash your hands to that verse, it'll be about 20 seconds, which is much longer than most of us ever wash our hands. But that's probably the single most important thing that you can do to prevent the spread of any infection, not only coronavirus. So if you can do that, and the other alternative would be to use a hand sanitizer liberally. And as long as the hand sanitizer has 60% alcohol, then that would be adequate as well. So if you can, read those handouts. If you have questions, there's also a link that you can use to send questions to us, and we'll be responding to those in the near future. Thank you very much, and be safe.